Good morning, everyone. It must be Monday because we are here with Dr. Katerina. Dr. Kat, good morning.
Good morning.
Welcome, everyone, to CBD with your favorite PhD. Today's topic that we're going to just dive right into, often get questions from people about how to use hemp CBD. What are the methods? What are the applications? And I think that's probably in the top 5 questions, Dr. Kat, that we usually get.
Yes, I would say so. A lot of people, as we've spoken in our other episodes, know about CBD. And so, the questions are, can I use it for this or that? And we've addressed some of those and we'll be addressing more. Some of the questions are, how do I know what to choose, which is going to be another episode, and how do I know it's good? But one of the biggest questions around there is, now that I have it, or I want to buy it, there's so many choices. So how do I know how to take it? So today we're going to talk about the different applications because there are so many. And we are talking about hemp CBD,
Right.
which is not cannabis. It is the CBD that we are using as a form of comfort, relaxation, and for symptoms that we've talked about before. So that has a lot to do with application. One of the things that I highly recommend for people is to understand that if they're going to use CBD and they react well, is to use it or ingest it orally or topically. And so you get an in and outside effect. And I will go ahead and I'll talk about those. And I'm going to go pretty quickly because there's so many applications. The one application that we're not going to talk about is smoking. I just read an article that in Texas, they're banning smoking CBD. As we know that it's an over-the-counter supplement that we're discussing. However, we recommend a pharmaceutical grade, something that we've talked about that we can dose. So part of the application is the dosing, right? So no smoking because of concerns over lungs. However, there are vapes that we'll talk about today that you can use. But again, that's at the bottom line. So the most common one is your oil. That's the one that most people are looking at. And so it, like we showed you last week, it comes in a dropper and we use something that's measurable. I'm going to be cooking with CBD. And so I'm going to be using, the whole plant, which has the CBDA, which we'll talk about later, but you can cook with the oil. Charlotte's Web makes one that has a mint chocolate. And Carmen, when you came to visit me at my office, you made chocolate cocoa, right?
Yes.
And you added that. And how was that?
Oh, it was wonderful. I mean, I love hot cocoa anyway. So then to add that, it really was. I mean, the flavor, because flavor is always important to me. So the flavor was fantastic. And then just that sense of well-being. And then, of course, it's just the chocolate.
Yes, and it added another level of relaxation, and it had a little bit of mint in it, which is nice.
Yes.
So it was almost like, I think it was winter. So
Yes,
it's a
it
little
was. It was.
yeah. So you can also take the oils in a capsule. And or some people dry it. We use the oils in the capsule because we use a full spectrum. And it depends on, the delivery. The oil goes underneath the tongue and it's delivered through your membrane. And so you don't lose a lot in digestion. So we usually look at the dosing around that. And so those are the two differences. Some people, they just want to swallow, be done with it. And then we have the milligrams also for each person's needs in that. There's a spray, which is also very lovely. You can spray that under your tongue. And we found this is good. It has a lower level of CBD and it's good for people who want to start. The other thing that was very interesting that I found and we brought to the office, and this is really selective. Some people like it, some don't, because it's a little bit of eucalyptus and menthol in it. And it's the nose spray CBD. And that's amazing because you just put it right here, you hold it, and it goes again in through the membranes and acts really very quickly. My other edible would be, because we talked about putting it in the mouth, is the gummies.
Sure.
And the gummies have a synergistic effect, as well as many of the oils when they're blended in with other terpenes. And we're going to have an episode on what that is. So don't worry about that right now. The gummies come in very delicious flavors. This one is for calm. So it has an infused terpene of limonene in it, which enhances your calm method. You can take it in a tea form.
Right.
And that's similar to
One of my favorites.
cooking. Yes. So I like this brand. It's organic, Buddha Teas, and it comes with so many varieties. And when we talk about CBD, we need to talk about the topical because we've talked about the pain. And you've heard us talk about the Bourbon brand, which is exceptional. Today I kind of wore my little rose in honor of Bourbon. Congratulations on your Kathy Ireland show being repeated again.
Thank you. Thank you.
It's wonderful.
Well, you are an integral part of that. So thank you.
Oh my goodness. I only do what I believe in. And so this smells like roses. But it's not about just the smell that brings the relaxation, because that goes into the nose. It's the terpene, the Damascus rose, that enhances the oil. And I believe this is 87% pure organic CBD.
When I purchase it, it's 86 right in there, and then when you blend it, of course, it dilutes the oh my gosh, I can't talk this morning. It dilutes it because you're blending it. So, but when I purchase it, yes, it is pure 80, right in there between 80-86%.
So because it's got a lot of CBD in it, and you got to mix it. And also we'll talk about why at another time, but this is perfect. This is what I carry in my purse, and you can see me on the Kathy. I'm like, recently right up in here, knees, toes. I put it in between my toes. In the back, sciatica. That's your topical, and it's a dermal, transdermal, so it goes straight to the spot. So you can ingest it, whether you're using a tincture or a capsule, and then I recommend putting an oil on there.
So it's the combination of the two.
Combination. Yes. And I know I'm going fast, you guys, but we're trying to do it in 5-minute nuggets, and we can redo if people ask for recommendations, ask questions. The other thing is a cream. I don't know if you can see this, but it spreads in bigger areas. And these come in strengths as well, depending on your need. The other thing that we have that we recommend are all the extras. So there's lotions that CBD makes. I personally, because I'm a big advocate of CBD for the anti-inflammatory, I say lather up. You know, this is 10 milligrams for several pumps on your body. So it's pretty, it's light, but it helps your skin. There's so many other benefits. And then there's the vapes for people who maybe would have smoked and want to transition slowly, or like that oral fixation. And these work like vaporize, like your diffusers. So it's not like smoking. And it looks like this. And for us, because we use organic, and we want to make sure it's not carcinogenic, because the oils that you vape with, we have to be very careful with. I choose to use the Canna Hemp brand for that. And we prefer that you use the oral or the pill. And one of my new favorites is the powder.
Oh,
CBD
wow.
collagen and MCT. I've been taking this brand, the multi-collagen, since I had my cancer diagnosis way back. Because of the medicine I was taking, it was constricting me. I couldn't walk. So the combination of the CBD oil with this was wonderful. And just recently, they've turned it into a chai flavor. They've added CBD in here. There's 5 milligrams. I put double. There's 9 grams of protein. You get all 3 collagen, which is great for your skin. And they have MCT oil in here, and it tastes delicious. It's got cinnamon bark, vanilla, and it's organic. Ooh. It's fabulous. I drink it every morning since it came out. And let's see what else. Yes, culinary. There's the new CBDA, which is in a raw form. It doesn't use just the CO2 extraction, but similar to olive oil. So you get to keep that in, and that's an oil that's very potent. So depending on your flavor, depending on the synergy, there are so many topicals. I hope today we got a little of information that there are different ways of taking it for different reasons. And we are here to help you with this. Please remember that CBD is not for everyone. Make sure you talk to your doctor. We want them to collaborate. We are not treating. We are not diagnosing. CBD is an over-the-counter. It's not a prescription medication that we are discussing today.
Right. Thank you so much, Dr. Kat. And where else? I know we rush kind of, we pack in a lot of information. And some people, a lot of times, as we have found, people need to hear it repeatedly, or they want their own private consultation. How do they do that?
That's a really good point. Thank you. So we do offer consultations. So if you're having an ailment, we consult you and we can help you with what to take. And people can reach us, or they can purchase it if they know exactly what they want and they've used CBT, but they saw something different here and they just have a question. So feel free to call us at 925-216-3510 or at our website, Insight for Wellness, INSIGHT, wellness.com, at the contact page. And then you can learn a little bit more on the deliveries on the CBD therapy tab.
Great. Thank you so much, Dr. Kat. We really appreciate all your insights, and thank you everyone for tuning in. And we'll see you next week on CBD with your favorite PhD. Thank you, everyone. Bye-bye, Dr. Kat.
Bye-bye. Bye, Carmen. Bye, everyone.